of the Senate Health, Education, Labor, and Pensions Committee, of course. Senator, thanks for coming in. You wrote a letter to Moderna about this, and in this, you called the price hike that they're considering outrageous. I also want to read through what we, at least so far, have heard from Moderna about this. The CEO telling the Wall Street Journal on Monday, I would think this type of price is consistent with the value of the vaccine. Have you heard anything back from Moderna?
Not yet. But look, what you're seeing here in Moderna is the tip of the iceberg in terms of what goes on with the pharmaceutical industry. We pay by far the highest prices in the world for prescription drugs. In some cases, 10 times more the same exact drug sold in other countries. In terms of Moderna, here's the story. This vaccine was discovered in partnership with the NIH, with a government agency supported by the taxpayers of this country. In addition, the government put $1.9 billion into research and development for Moderna, and then guaranteed Moderna billions of dollars in sales. And then, as a thank you to the taxpayers of this country, what Moderna says is after we deplete the government supply of free vaccines, they're going to quadruple the price of that vaccine. And meanwhile, they're going to charge whatever it is, $110 a vaccine. It costs them about $2 to produce that vaccine. And then on top of all of that, in the last few years, since this vaccine has been on the market, we got the CEO of the company making billions of dollars, becoming a multi-billionaire, as well as other executives. So the taxpayers of this country who put money into the vaccine in order to protect the health and lives of the American people are now creating billionaires in the industry, in a company that is going to quadruple prices for the American people. That is outrageous, that is unacceptable, and we've got to do something about that.
You've noted, and also Elizabeth Cohen was just explaining as well, that not all Americans are going to be paying out of pocket for this. Medicare, Medicaid, and other government health care plans, they'll continue to cover the cost of vaccines for patients. So I wonder, from your perspective, you say you need to do something about this. What is an acceptable solution to you?
Okay, let's be clear. Medicare and Medicaid will pay for it. Will cover the individual, but they're going to have to pay the higher price, and that costs taxpayers money. And then you got, tens of millions of Americans who are uninsured or underinsured, and there's no private insurance company. Medicare, Medicaid are not going to cover them. They're going to have to pay out of pocket. I think the bottom line here is that we are looking at strategies in how to deal with it. But I think the area we've got to focus on is if the taxpayers of this country put money through the NIH into developing a drug, and it's certainly not just the COVID vaccine, many cancer drugs as well, should they then be forced to pay the highest prices in the world for a drug which they helped develop? And I think the answer is obviously no. So if taxpayers are going to pay for the research and development, they need to make sure that the product being produced is affordable.
We'll wait and see how Moderna responds. CNN, we are seeking comment from Moderna on this one as well. I do want to ask you, because your the Democratic Senate majority is now, when you talk about getting any work done, if it has to do with this or something else, you must work now with the new House Republican majority. And while we don't know the full picture yet of how Kevin McCarthy's conference plans to operate, there are promises of budget cuts that could include cuts to defense, to Social Security, and Medicare, as we're discussing here. CNN is reporting that part of the promise that we have heard about is to reject, quote, any negotiations with the Senate on funding bills if they don't meet the House criteria. What do you say to that?
Well, I think we're going to take the case to the American people. And my guess is, Kate, the American people do not think it's a great idea to make massive cuts to Social Security, Medicare, Medicaid, and the needs of ordinary Americans while maintaining, for one example, the massive tax breaks that Trump and the Republicans supported when Trump was president, tax breaks that went overwhelmingly to the rich and large corporations. So if we want to talk about getting a handle on federal spending, I think for a start we may want to ask ourselves why we have billionaires in this country who in a given year don't pay a nickel in federal income taxes, why the effective tax rate for the very, very rich is lower than it is for working families. So let's talk about a fair tax system. Let's talk about why we ended up just recently, against my vote, I gotta say, increasing military spending by $80 billion in 1 year. Let's talk about all the corporate welfare that's out there. But bottom line is, if the Republicans want to cut Social Security, Medicare, Medicaid, and education, let them take that case to the American people. They will lose. We will win that debate.
I feel like we're going to be covering quite a bit of this coming up, Senator. So look to have you on and see what that debate looks like. Thanks for coming on. I appreciate your time.
Thank you.